Dear Greg, one of my best friends was diagnosed with metastatic ovarian cancer a few months ago, and she doesn't have long to live. Everybody is sad about it. In a couple of weeks, I'll be going to visit her for a few days, and I'm having some mixed feelings about it. I want to see her, but I'm also confused and anxious. I don't know what to say to her. I haven't accepted what's going to happen to her. I can't believe it. I don't want to believe it. It's so unfair this is happening to this brilliant young woman, and yet I'm supposed to go there and comfort her? I don't even know how to handle this. Am I supposed to tell her that she's going to a better place? I don't even know that. I don't know what happens after this life, and I know she's not religious, and I've heard that she's starting to ask people questions about what happens after she dies. She's getting very depressed. What am I supposed to say to all that? I'm starting to talk myself out of even going to visit her, but I know I should go.
Your friend is dying, and for most people that is the most confusing, frightening, lonely time in their lives. From what little you've said, it sounds like this is true for your friend as well. So here she is, confused, afraid, depressed, and alone, and the primary concern you've expressed here in your letter is for yourself. You're concerned about your confusion and your anxiety. You're dealing with your denial about her death and your own frustration that this is all terribly unfair. And you're very afraid about not knowing what to say to your friend. You're so consumed with your own needs and fears here that if you went to visit your friend in this condition, you'd probably be more of a burden than a help to her. Now, lighten up. It might sound like I'm criticizing you as I say all this. I promise you I'm not. My sole interest is to help you see the truth about where you are and what you're doing. Because only then can you begin to learn what your friend needs and begin to take the steps necessary to actually help her. Learning and growing always begin with telling the truth about where we really are. You are not unusual in your attitudes toward the death of your friend. When people are dying, it's normal for the people around them to react like you are. Many years ago, for example, a study was done with a large number of patients in a hospital. The people doing the study simply counted the number of times per week that the patients were visited by their physicians. And they discovered that the moment patients were diagnosed with terminal illnesses, the moment it was learned that they were going to die, those patients were visited by their doctors less than half as often as before. When people are dying, we don't know what to do. We feel stupid and helpless. We do not like those feelings, so we tend to avoid the situations where we have those feelings. We avoid situations where we might fail. We avoid situations where we won't know what to say. We want to be in control. We want to know what to say. We want to be able to fix things if they're broken. And that's why we feel so uncomfortable around people who are dying. We'll talk more about this in our next session.